crushed bones, melted skin, and hearts that stop, but somehow don't. Today, we're diving into the most haunting medical injuries, the ones that don't just scar the body, but stick in your memory forever. All right, let's dive right in. Number 1, ECMO resuscitations. Life on the edge of death. The first one isn't just gruesome for some, it's actually surreal. Imagine this, a patient whose heart has completely stopped, but their body is still moving. Blood pumping through larger than you'd like tubes, and the machine besides them humming softly. That's ECMO, extracorporeal membrane oxygenation, a truly last resort life support system that takes over when your heart and lungs fail. You'll see it in the most desperate moments in the ER. Massive cardiac arrest, near drownings, catastrophic pulmonary embolisms, and even extreme allergies can put someone on the brink of death. In that case, we thread tubes into major blood vessels, pull the blood out of the body and oxygenate it, warm it, and pump it back in, essentially becoming both an external heart and a lung for the patient. It's a miraculous procedure, but it's also deeply haunting for some who see this process unfold. Every doctor who's been a part of an ECMO code feels it and remembers it. The eerie calm after the chaos, the rhythmic hiss of the machine, and the family watching from behind glass. And sometimes the machine keeps them alive long enough for recovery, and sometimes it doesn't. These are truly a last-ditch effort for the most emergent of individuals. Number 2, degloving injuries. When skin becomes a faded memory. There are injuries that make an entire trauma room go silent, and degloving is one of them. It happens when the skin and soft tissue are peeled away from the underlying muscle, truly like peeling off a glove. You'll see it in factory accidents, car rollovers, motorcycle crashes, even treadmill injuries in kids. To outsiders, it looks like something out of a horror movie, but for medical teams, it's a delicate nightmare we see far more often than we'd like to. And when degloving injuries happen, the clock starts ticking immediately. The longer the tissue stays detached, the less chance it has to survive. We have to irrigate, clean, and sometimes attempt microsurgical reattachment, literally replumbing the body's blood supply. And when it comes into the hospital, you compartmentalize in the moment. You focus on function. Can you save the limb? Can we stop infection? The sheer wrongness of seeing anatomy out of place, that sticks with you. Number 3, pediatric drownings. When silence is the loudest sound. Ask any ER doctor what case they'll never forget, and many will say the same thing: a child pulled from water. Drowning cases of anyone are emotionally devastating, but drowning cases of kids, it pulls at your heart like you just never expect. They arrive suddenly, without warning. The entire room's energy shifts. Everyone moves fast, nobody talks. Parents stay frozen in horror in the doorway, watching their loved one on the table, praying for breath. You can hear a pin drop between the sounds of the monitor and the chest compressions. If you're lucky, the child starts breathing again. If you're not, everyone holds for a moment in silence. That silence is what haunts you. It's these kind of cases that make even the most experienced ER staff step outside for air. You tell yourself you fought hard for someone's entire future, but ultimately with any unexpected passing, you realize it's just part of the job, but it never really leaves you. Number 4, necrotizing fasciitis. The monster you can't see coming. Flesh-eating bacteria sounds like a bad movie plot, but to ER doctors, necrotizing fasciitis is one of the most real and terrifying diagnoses we make. It often starts innocently: a small cut, a bruise, a bug bite that looks irritated. The pain seems out of proportion to how it looks, but within hours the skin turns purple, the swelling spreads, and the patient starts going into septic shock. That's when we know it's something else entirely. The bacteria are releasing toxins that destroy tissue faster than we can remove it. Surgery is the only answer, and even then, we're sometimes chasing it up a limb, cutting away more and more in a race to save the person's life. The haunting part isn't just the physical devastation, it's the speed, the unpredictability, the way a healthy person could go from walking into the ER to fighting for their life by nightfall. You never forget that things move quickly in the emergency department, knowing the infection is moving faster than you can cut it out sometimes. And even when the patient survives, the scars, physical and emotional, are enormous. Number 5, open globe injuries. When the eye sees too much. You can tell when someone new to medicine encounters their first open globe injury, or put it simply, a ruptured eyeball. Their face goes pale like they've just seen a ghost. It's one of those injuries that bypasses your logical brain and hits something primal. The eye isn't just anatomy, it's identity a lot of the times. It's how a lot of us connect to the outside world. Seeing it damaged feels wrong in a way that few other injuries do. In trauma, it's often from shrapnel, tools, or explosions, a small puncture, a sudden collapse of pressure, and suddenly the clear cornea is opaque, fluid leaking, and iris prolapse. The goal is to cover it immediately and do nothing nothing else. No pressure, no poking, just shield and rush to the operating room. What makes it extra spooky isn't just the injury itself. It's what it represents. Losing an eye changes how you see the world, literally and figuratively. And for doctors, it's the fear of doing one wrong move, 1 second of mishandling, and turning a repairable injury into permanent blindness for a patient. That moment doesn't leave you if a patient ends up losing their sight. Number 6, massive burns and airway swelling. Fire victims are always haunting, but not for reasons you think. It's not the flames that we see in the hospital, it's the airway. When you inhale hot gases or toxic smoke, the damage isn't immediate. The tissues swell slowly, sometimes over hours. So a patient can walk into the ER talking, and a few hours later, their throat has swollen shut. You learn early in emergency medicine, the airway always wins. If you wait too long, you can't get a tube in and you can't get oxygen through. These few seconds deciding whether to intubate early, that's what sticks with you, especially early in your hospital career. Because if you're wrong and you don't intubate at the right time, they'll never breathe again. Burns also carry a distinct smell, a mix of protein, smoke, and something your brain knows is burned human flesh. The smell clings to your clothes, your mask, your memory. And even after decontamination, you swear you can still smell it. And then there's the skin itself, blistered, sloughed, and unrecognizable. It's the body's largest organ suddenly stripped of its barrier, raw and exposed to the world. You can cover it, you can graft it, but it never looks or feels the same again. And for the patient, the pain is indescribable. Nerves firing like live wires, sometimes so intense that even morphine can't quiet the screams that echo through the hospital. Fire doesn't scar just the skin, it imprints itself on everyone who fought to save it. Number 7, Lazarus Syndrome, when the dead come back. If there's one situation that eerily lingers both medicine and the human imagination, it's this. When someone is declared dead, but then suddenly comes back. It sounds biblical, but it's real. It's called Lazarus Syndrome or auto-resuscitation after failed CPR. It's when a patient's heart starts beating again minutes, sometimes even 10 to 15 minutes after resuscitation efforts have stopped. It's rare. In fact, not many well-documented cases worldwide, but every single one defines everything we think we know about death. The theory is that trapped air pressure in the chest during CPR can prevent the heart from refilling properly. When that pressure finally releases, blood flow returns and the heart restarts on its own. Imagine the scene. The code is called, the room quiets, monitors are flatlined, the team steps back in exhaustion, charting the time of death, undoubtedly sad, and then an unexpected pulse flickers. If you ever witness that moment, someone's heart restarting after being pronounced dead, it doesn't just shake your faith in medicine, it rewrites your understanding of life itself. Number 8, the ones who look fine, hidden killers. And finally, maybe the most haunting of all, the patients who look fine but are really knocking on death's door. They walk in under their own power, maybe a little pale, maybe complaining of a sore abdomen. They joke, they text loved ones, they seem stable to the untrained eye. But something in their gut says this just isn't right, and sometimes it isn't. Hidden killers like internal bleeding, a ruptured spleen, a torn aorta, things that hide underneath a normal pulse until they don't. One moment a patient is sitting up, the next their blood pressure plummets, and crash carts are called. Those are the ones that keep you up at night as a healthcare provider, because you think back and wonder, did I miss something? Was there a clue, a sign? They teach you humility and they remind you why medicine never allows complacency. Just because someone may look okay doesn't mean they are, because in the emergency department, every case matters and every patient could be the one standing on that line between life and death. I'm curious, let me know in the comments, which of these cases do you think would haunt you the most? Or if you work in healthcare, anything that really haunts you, let me know in the comments too. And if you want to keep exploring the darker, stranger side of real medicine, check out this playlist right here. It's filled with other episodes like this. And of course, please make sure you subscribe, hit that like button, and turn on your bell notifications. That way you don't miss any new videos we post. Thank you so much for watching, and stay healthy, my friends.